Dr. Fry. This is Seth Harrison at the Center for Manual Medicine and Regenerative Orthopedics. We're talking today about ultrasound guided, ultra minimally invasive trigger finger release. A trigger finger is a very bothersome problem. The flexor tendons come right down along the bones here, and there's two of them. And they attach here and they attach here. So if you pull on the flexor tendon and you bend your finger, if there wasn't something holding it to the bone, it would bowstring and you would get an effect like that. Okay, so there's ligaments that are like little U anchors, okay, that are holding this down to the bone. There's 5 of them. Okay, so A1 pulley, they're called pulleys. A2, 3, 4, 5, okay? But only the A1 is the problem. The A1 can get thickened, okay, and pinch the tendon, and so the tendon bunches up there. And then, when you pull hard enough this way, it goes and pops through. Can be kind of painful. Sometimes it's not too painful. Unfortunately, once it's through, coming back the other way can get caught. And if it gets tight enough, people end up with only that much ability to bend because it gets tight and it won't go through. So now you're not stuck like this. Initially, people are locked in this and you have to open it with the other hand, pop like that. But after it gets too tight, then we have people come in, they're like this, they can't bend their finger anymore. So that is a big problem, especially if it's their dominant hand. So what I do is use the ultrasound and we can take a look at what the problem is and just stick some right there. A bunch. Yeah. He's like real stingy with the ultrasound gel. Okay, so what we're going to be doing is looking at the flexor tendon. So there it is. The bone is bright white. The flexor tendons are on top. They're white ovals, okay? And you can see the bottom one moving. There's 2 of them, one on top of the other. And around it, you can see a black, dark hip freeze. All right? So you can see this, all right? And that is the tissue around the tendon called the sheath. And you can see here, if we measure that, how thick is that thing right there? It goes there. To there. So it's 0.2 of a millimeter thick. Not much. All right. So with the trigger finger, when we're looking, there's the thicker part. Hit that. All right, you're going to see this dark here and this band on top be more like a millimeter or even 2 millimeters so that the tendons can't get through. When we're looking lengthwise, okay, you can see the tendon moving there. Freeze it. Okay, so the A1 pulley is right in here across this joint. You can't see it, it's so small, but if it was thickened, you'd see a thick layer right across here. So what I do when I'm doing the treatment is I take a syringe and I make a knife out of it. So the syringe has got a bevel. The bevel is placed sideways and bend up, and then I bend it again so that I can come in underneath that pulley and then pull up and make a little incision. So I'm going to be coming in this way. I inject some numbing medication with a tiny little needle, 30 gauge needle. So yes, it stings a little bit, but it's not bad. Numb up this whole area so you don't feel any of what I'm doing. I'm going to come up underneath that pulley and come down and pull back a little bit, and you'll feel the ligament cut. It'll go crunch, and the patient will feel it and I will feel it. And I do that until I'm through the entire length of the A1 pulley, or the width, and then I pull out and we check and see, and the popping goes away. Or if they weren't able to close all the way, now they can. So when they leave, the problem is solved. You put a Band-Aid on and say, don't do heavy gripping for a week or two. You're fine. You can go home and play piano, do whatever you want to as far as that type of thing.